All right. Hello, everyone. Thank you so much for being here today. We are very excited to present our event, Shaping the Future of Healthcare, which was a collaboration between the National Prehealth Conference and Wave Learning Festival. So today we have some very exciting presentations. First, we will have our keynote event with Dr. Fiona Feller, who is an internal medicine resident at Mayo Clinic. And after that, we will have our panel discussion with um, Rohini, who is a medical student at UCLA, Amy, who is a nursing student at UPenn, Sammy, who is a pre-med student at UPenn, and Shruti, who is a dental student at University of Buffalo, University at Buffalo. So this event was organized, as I mentioned already, by the National Prehealth Conference. And this is me. I am the founder and co-president. And we also have Alexia joining us today, who is the co-president. And from Waves team, we have Madison, who will be leading the panel discussion. And we have Simon and Jambi, who helped us organize this event and contact speakers and be ready to have an awesome presentation for you guys. So the first announcement today is we want to let all of you guys know that the National Prehealth Conference has opened up its registration for our annual event, which takes place during the summer. And this is a fully online and virtual event that happens for free. So you can register and you'll be able to attend the event, where we teach students about different healthcare specialties, how to become competitive candidates for medical school, nursing school, and all different healthcare schools. And we also will have special events. So we want to encourage everyone to please register if you haven't done so already. And we also want to encourage all of you guys to stay connected with us through our social media. So you can find us at www.nationalprehealthconf.org. And we'll also have all of these links on the chat. So if you guys are interested in learning about what we do and being more connected with the pre-health community that we at the National Pre-Health Conference have, feel free to join our different social media and check out our website to learn more. And we also encourage you guys to join our newsletter, which is our main form of communication with our students. And through our newsletter, we provide resources such as scholarships, graduate and professional school information, opportunities, and upcoming NPHC events. And now we will transition to our WAVE representative with Madison, who also has some announcements from WAVE.
Yeah, thank you so much. So my name is Madison. I'm here to represent Wave Learning Festival. We're an education nonprofit that was founded around April of last year. And we offer free tutoring services, seminars, and special speaker events like this one. You can support WAVE in a variety of ways if you're interested. You can register for workshops, which are seminar-style classes across a variety of topics that you won't usually find in the classroom, covering everything from financial literacy to French history to environmental advocacy. And WAVE is really proud to offer free tutoring across every academic subject. All you need to do is reserve a free session, and you can do that through our website at wavelf.org. I just dropped the link in the chat if anyone's interested about learning more. And if you're interested in joining the team as a tutor, we're looking for volunteers who can give about 1 to 3 hours per week. The application info is also on our website. Next slide, please. And if you're also looking for other ways to support WAVE, you can select us as an Amazon Smiles charity, and a small amount of the proceeds from all of your sales on Amazon will go to WAVE. And if you want to learn more about us in general, you can visit our website, which is linked in the chat. So thank you guys so much. And now we're going to be transitioning to our keynote speaker, Fiona Feller. And she's going to be introduced by Alexia Childress, the co-president of the National Prehealth Conference.
Thank you so much, Madison. As Madison said, my name is Alexia, but feel free to call me Lexi. And I'm the co-president of the National Prehealth Conference. I work alongside Alejandra to make all things happen in PHC. And we're really excited to be collaborating with Wave Learning Festival today to host our keynote event for shaping the future of healthcare. I have today Dr. Feller, who is an internal medicine resident at Mayo Clinic, Arizona. And she has some exciting presentation today to share with you. And so whenever you have the chance, Dr. Feller, go ahead and share your screen and we can get started.
Sounds good. Thank you, Lexi. Let me get my screen up. All right, here we go. Okay, everybody see screen okay? Can get started. This is the code here. If you'd like to join. Lexi, do they need any other instructions how to join?
I can give some instructions. So this presentation is a little bit different. It is an interactive presentation where you can join on your phone. For those of you who might be familiar with using Kahoot when you were like in high school or anything like that, it's kind of like that. Go ahead and join the link joinpd.com, which I will put in the chat right now. And it's also an app if you want to quickly download it. If not, you can just go in your browser and type that in your URL. And so the code is on the top right of the screen, which I can also put in the chat for you, CXQ. The code is FBSZXQ.
I think I'll give a little bit of time for people to join.
Dr. Feller, can you see on your screen how many people have joined?
Let's see.
Oh yeah, I think, I'm not too sure.
I'm not sure how to find that information.
That's okay. What we can do is if you have joined, go ahead and just give a thumbs up on your screen. If you click on reactions on the bottom black bar and click on the thumbs up icon to let us know that you have joined, that will be awesome. All right, I see some thumbs up. Perfect. We'll give it about 1 more minute so we can get started at 12:10. And if you can, just go ahead and keep that thumbs up. All right, let's go ahead and get started. And if you were able to join, no worries. You can continue to join at joinbd.com with the code at the top right of the screen throughout the entire presentation.
Awesome. Thank you so much, Lexi. Thank you everyone for joining in today. I'm really excited to talk to you today about the impact of the pandemic has had on healthcare, particularly on how it has brought us closer together. A little bit about myself. I am, like Leslie had mentioned, I'm an internal medicine resident physician at Mayo Clinic in Arizona. I am in my 3rd or last year of residency. After I graduate this summer, I'll be moving on to pursue a fellowship in infectious diseases in Yale New Haven Hospital in Connecticut. So this is a topic that's very important to me. Before we get started, I know that all of you are joining in from many different places. I'm curious to see where everyone is joining us from. On your phone, you should be able to draw actually where you're listening from. I'm curious to see where everyone is streaming in from. So I am actually in Scottsdale, Arizona, kind of around this area right here. Let's see.
And then go ahead and click on the overlap on the top left corner so you can see everybody's responses.
Top left corner, is it this one?
Yeah, the 3rd button. Yeah, the overlaid layout.
This one. Mm-hmm. Oh, wonderful. From everywhere. Great. Well, welcome everybody. So excited that you can all join us today. All right, let's move on to the next slide. Next, my next question for you today is, I'm curious, which role of healthcare are you most interested in? And there should be a list of options for you here. I want you to know that when I was in your position, I certainly did not know what I wanted to do. So for that reason, I put an undecided option in. So I'll give you a minute to put your responses in and we'll take a look. Let's see. Oh, wonderful. So I see quite a variety here. Nursing careers, physician, physician assistant, PT, OT. Wonderful. Okay, thank you all so much for responding. All right, so next I want to take you through what a typical day looks like for me working in the hospital. But before that, I like to talk to you about what does the journey look like typically to become a doctor, since some of you have expressed interest in this. So the journey really starts with medical school here. And I want you to know that medical school typically, before that, they require 4-year undergraduate or college degree. In medical school, you learn the basics on how to become a doctor. So you attend a lot of classes and you start rotations in the hospital. Typically, this is 4 years long. After medical school, then you move on to residency. This is where you actually learn how to be a doctor by working in the hospital and the clinics. This is also where you get to train to be the kind of doctor that you want to be. So for me, I wanted to be an internal medicine residency, so that's what my program is. After residency, you can go ahead and practice as an attending physician. Attending physician basically means you are a practicing doctor in the community. You have finished training. Or after residency, you can do more training to specialize. So this is called fellowship. So I wanted to pursue a fellowship in infectious disease. Typically, fellowships are about a year or longer. You can pursue as many fellowships as you like before you move on to become an attending physician. What's important to know is every journey is different and there is no one right track. I know a lot of colleagues actually who have completed other careers before they decided to change their mind and pursue a career in healthcare. For me, my journey is a bit different too. So instead of going from college straight to medical school, I did take a year off. One, because I needed more time to prepare myself for med school. And I spent the year working in healthcare to make sure that this is actually the career that I wanted to pursue to become a doctor. And lastly, that there are many tracks to become a healthcare professional. There's nursing schools, PA schools, advanced degree programs. So being a doctor is not the only path. Now, let me show you what a day looks like, a typical day looks like for me in the hospital. So typically I get to the hospital around 6 a.m. in the morning. This is our beautiful building in Phoenix, Arizona. That's our hospital. And these are the big windows looking outside to the gorgeous Arizona mountains. I head straight to the resident workroom as soon as I get there. There is a resident in this room basically 24/7. When I took this picture, I was standing in the corner of the room. You can see on the time of the computer here, it's 2:50 a.m. It was during my night shift. I was waiting for my colleagues to arrive around 6 a.m. so I can give report to them about what happened in the night to their patients. And so we can do the same thing all over again later in the day. So about an hour later, we have basically a class. What you may not know, residency is actually all about education. It's all about learning. You are learning at the bedside with patients, but you're also having dedicated teaching sessions like this. So you'll see throughout my day that we have multiple classes that we go to. So at 7 a.m., we have something called morning report. It's essentially a teaching lesson like this. So it's usually led by a chief resident. They present a quick case and we go over them together. Sometimes we spend the morning in the simulation lab where we practice basic clinical skills on a mannequin. So this allows us a safe environment to hone our critical care skills. So here we are practicing how to bag a patient. That's how to provide extra oxygen to someone who's not breathing well, or perform CPR like it's in this case. This monitor tells you how well you're doing your CPR, how deep you're pushing. And then what's cool is that these mannequins are controlled by a doctor and a tech at the other side of the mirror here. So as you're going through the case, they'll be able to walk through it with you. And then after that, we basically meet together as a team to do rounds. So rounds is a term that we use to describe that we go around in the hospital, seeing our patients at bedside, developing and implementing plans for the day. On this picture here, this is basically what rounds look like in the hospital. So you have an intern or a first-year resident presenting to the rest of the team, which consists of the attending physician, senior resident, pharmacist, and also another first-year resident, but what to propose the plan of the day. And after that, we go into the room and discuss with the patient right at their bedside. Now, rounds take many different forms. It has many different sizes. So this on the picture on the top here is actually a picture of what rounds typically look like in the critical care unit or the ICU, the intensive care unit. The ICU houses the sickest, complicated patients in the hospital. So naturally, there's more manpower down there. In addition to the typical team that we see on the general floor like this, we have the ICU nurses, social workers, nutritionists, ICU pharmacists rounding with us. So it's a pretty big team. Rounds typically last around 2 hours or so. After that, it brings us to 11 a.m. Where we implement our plans for the day. I also want to mention that sometimes when the weather is nice, we take advantage of that by starting to discuss our patients in our patio, which is great. Around noontime, we have another class, which is called Noon Conference this time. This is a case or a teaching session led by an attending physician. We also take this time to take a break and eat with our colleagues. The rest of the day we spend to make sure that the plans that we had made earlier in the day were followed through, the results are looked at, coming back to our patients and their families, make sure we address all of their concerns. Sometimes in the afternoon, we also have more classes. Recently, we had an ultrasound class like pictured here. This time we were learning about the ultrasound of the heart. And then the COVID-19 pandemic happened. So in Arizona, we began seeing our first cases back in March of last year. This picture on the left-hand side with the 2 wooden double doors, I took that picture around that time in March. And that was the first time that we had closed a pod or a specific wing of the hospital specifically for COVID-19 patients. And I think at that time, we kind of knew that bigger things were going to happen. And fast forward several months later, fast forward to now we have erected this tent outside of emergency department. This is the entrance to the tent. This tent, the purpose of this tent is to triage and treat patients who we suspect to have COVID before we bring them into the hospital. So it really allows us to have greater capabilities and room for these patients. I like to share some pictures of my colleagues and I during the pandemic. This picture here on the left is a picture of me and 2 of my first-year residents of my medical team during the first surge month in June of last year. We were wearing our gear. This was the very last day of our service. So we were celebrating at that time too, being done with our month. We have an N95 underneath the surgical mask, goggles, and a face shield. That's a typical headgear looks like. We can substitute the N95 with a respirator like this or like this. It's hooked up to its own air exchange system that you wear on yourself. And of course, we also wear a gown and gloves. This here on the right lower hand side is a picture of me during the ICU month. I worked in the ICU in July of last year, also during our surge in the COVID ICU. So that was an experience as well. Now, I'd like to share with you a really inspiring story of a patient that was admitted to our hospital for a really long time. The reason why I wanted to share this story is I really want to drive home the point that the healthcare teams really worked together to help her get out of the hospital safely. And because of patient confidentiality and HIPAA laws, I will only be sharing with you the facts of the case that have been publicized online. So this is an article from azcentral.com. It's one of the news organizations in Arizona. The story has also been publicized by Mayo Clinic News Network, Good Morning America, and Yahoo News. This is a story about Reyna Lopez. She was 31 years old at that time when she came into the hospital last year. She spent about 4 months with us in the hospital from COVID-19 complications. A little bit more about her. This is taken from the Mayo Clinic News Network. She, when she first got sick, she just had an 11-week-old baby at that time. Unfortunately, because of COVID-19 complications, she spent a total of 4 months in the hospital. 88 of those days she spent on a heart-lung machine. In COVID patients, sometimes when their heart and lungs fail, we essentially have to put them on a machine that takes over the function of their heart and lungs. It's called the Ecmo Machine, or the Extracorporeal membrane oxygenation, as is written here. This is a stock picture that I found online of what a typical Ecmo machine would look like. We use this machine in open heart surgeries, for example, when we have to stop someone's heart, but we have to keep them alive by using this machine. In reality, this is what it looks like in the typical ICU room. You can see there's a lot of machines. The machine is right in the front here. It's in front of multiple monitors, computers, IV pools. Now, I'm going to go through what each member of the healthcare team and what their roles are in taking care of someone who was sick like Reyna in the hospital. So first and foremost, the registered nurses, they were at Reyna's bedside 24/7. There are multiple types. What you may not know is that there are multiple types of nurses out there. So there are nurses with special certifications as well. So for someone like Reyna, who was put on an ECMO, a heart and lung machine, it requires a very special team of nurses to operate this machine. So these nurses have special skill sets and certifications so they can operate the device. On the left-hand side here is a dialysis machine. So some patients get so sick to the point that their other organs fail, like their kidneys. They are put on a dialysis machine like this. Again, this also requires a very specific team of nurses to operate them. So they are completely invaluable to our team, and we work, as doctors, we work with nurses every single day in our practice. Next, there are nurse practitioners. So nurse practitioners, they complete additional years of training after nursing school. We work with them a lot at Mayo. They are right there with the medical team, making clinical decisions with the rest of the team. They work in various clinical settings. They work with all kinds of ages, adults, kids, babies, and they work in various medical and surgical specialties as well. They're also physician assistants. So usually after college, they go to PA school, which is typically 2 years long. Physician assistants also work in a breadth of clinical settings. In Mayo Clinic, they are embedded in various teams, so such as cardiology, gastroenterology, hepatology, and surgical services. So they work right alongside physicians and also nurse practitioners. Next, there are physicians. As you know, there are various specialties, subspecialties of being a doctor. What I would say for those of you who are interested in becoming a physician, one way to start narrowing down what kind of doctor you'd like to be is to think about what kind of patients would you like to treat. Do you enjoy working with kids, adults, or both? That's also possible. The elderly, or infants, babies, and pregnant women. And these may help steer you towards the perfect physician role for you. Pharmacists play a central role in the healthcare system as well, particularly in someone like Reyna, who was in the hospital for, as you know, months and have had multiple medications to help keep her healthy while she's in the hospital. So the pharmacist's job is to review the medication list, make sure they don't interact with each other, making sure that they're on the correct doses of medications. Sometimes you also have patients who have multiple drug allergies, so we have to make sure the medications that they are on are safe for them and there's no cross-reactivity. Additionally, in the hospital setting, whenever there's an emergency like a cardiac arrest, for example, the pharmacist is right there next to you working to make sure that they mix the medications correctly and handing them off to the medical team to give to the patient. So they are extremely invaluable to the medical team. There's also the respiratory therapist. So a respiratory therapist's job is to treat, diagnose, and assess lung and breathing disorders. As you can imagine, they have treated many, many COVID-19 patients. They help these patients breathe better by selecting the most appropriate breathing therapies for them. Sometimes COVID-19 patients also have to be on specific breathing machines. Some of them you may heard of is CPAP, BiPAP, or even a breathing machine like a ventilator. So they are experts in functioning these devices, and they help make sure that the patients are on their correct ones. There's also physical and occupational therapy. These are two separate fields. Physical therapy focuses on movement of the body and also recovering from a specific injury. Occupational therapy is making sure that someone has the ability to complete activities of daily living successfully. So these are actually pictures of Reyna while she was in the hospital. This was published in AZ Central News. This is a picture of the occupational therapy working with Reyna to complete an activity of daily living is what we call it. So some examples of that would be getting in your car or getting in your shower. These are pretty simple tasks for healthy people like you and me. But imagine for someone like Reyna, so who has been on the heart and lung machine for 88 days. And keep in mind that when you're on this artificial heart and lung machine, you are actually asleep under anesthesia the entire time, also connected to a breathing machine. So when someone like Reyna woke up, then they would need to start learning how to regain their strength, how to learn how to walk again, for example. So this picture is showing the OT or the occupational therapist working with her how to put away groceries safely. So these are activities that she would have to do at home, but we have to teach them to make sure that they know how to mobilize properly to do this. So PT and OT definitely plays a pivotal role in making sure that our patients transition safely to home after leaving the hospital. There are also speech therapists. So they focus on assessing, treating, and diagnosing speech, language, and swallowing problems. They work with all adults, basically of any age, kids. In someone like Reyna, who has had a breathing tube in her throat, in her windpipe for months, when that gets taken out, she needs to learn how to use her vocal cords to speak properly again, for example, learn how to swallow again. And that's when the speech therapists come in. They are equipped with skills how to assess this at bedside, as well as they also use imaging techniques like live x-rays to see what their swallowing function is like. They work very closely with the nutritionist or the dietitian. As you know, someone's nutrition is very important in their health, especially if this person has been sick for a long time. Nutritionist helps make sure that our patients have the right amount of calories in their diet, have the right amount of food. They also take into account patients' allergies, preference, and budget to make sure that they have the right meal plan for them. So this is, in summary, it takes a whole village to care for someone like Reyna. We needed every single person to make sure that she had a good recovery. It is truly a multidisciplinary team approach, and we all worked together to achieve this day. This was the day, October 23rd, when Reyna finally left the hospital. It was published on the Mayo Clinic News Network. Actually, this was the Ecmo staff that wished her farewell. She has very much become the symbol of hope in our hospital. We have treated very many sick patients, and it's not always as smooth and harmonious as I have perhaps painted it to be during my presentation, but it's for moments like this why we do what we do. On the right here is a picture of Reyna with her family outside of the hospital. This was also published in the news. As you know, there's a no visitor policy in the hospital, so Reyna couldn't see her family for a long time. When she finally got healthy enough, we were able to wheel her bed out to right outside of the hospital so her husband and her children could visit her. So in summary, COVID-19 has challenged every single aspect of healthcare as we know it. Despite its challenges, the pandemic has taught us new ways on how to care for and connect with our patients. Telemedicine, for example, is something that's been around for a long time, but its use has never been as widespread and applicable as it is today. The pandemic has tested us on how we keep growing as clinicians in our field. How do we treat and diagnose patients efficiently and appropriately virtually through video or through phone? As trainees, so as residents, how do we keep growing as doctors in our fields among this pandemic? We have had to switch a lot of our learning from in-person to Zoom, for example. The pandemic reminded us on the importance of research and evidence-based medicine and how medicine is an ever-changing dynamic field. And lastly, like I've said before, it has strengthened our collaborations and sense of camaraderie among the healthcare teams. I like to end with a quotation. This is actually a wall that I walk past every time I walk into the hospital, actually. And it says, "No one is big enough to be independent of others." It's true before, and it remains even truer now. I'd like to thank you for your attention. Thank you to the National Prehealth Conference and the Way of Learning Festival for having me here today. I'm happy to take any questions. We'll take my screen sharing off now.
Thank you so much, Dr. Feller, for that amazing presentation. It was truly, it just really made me think, and it was awesome. So thank you so much for sharing.
Thank you.
We have plenty of time for our Q&A session. So I'd like to open up to the audience. If you have any questions, feel free to put them in the chat, or if you want to raise your hand by clicking the raise hand function. I'll teach you how to do that. If you click on the participants button in the black bar, you should see all of your names pop up. Click on more. Actually, never mind. Go ahead and just use the reactions button and then click the thumbs up button if you have a question. Sorry about that. I have some questions from the chat during your presentation. And so I'll just go ahead and ask those first. Daniel from the audience asks, do you know of any opportunities to shave off some time in medical school, like accelerated courses or programs? If you have taken any or not, do you recommend taking accelerated courses like those?
Okay, thank you for your question, Danielle. That's a good question. Medical school, as you know, traditionally is 4 years. I do know of some programs out there that combine med school and undergrad in 6 years. I know that there's not very many of them, and I don't know the specific program names, but I think 4 years of medical school is probably the shortest it can go. And to be honest with you, it's so much information in medical school that I'm not quite sure how to shorten it even more, even though it would be nice, right, to be able to advance in your training and get to where you want to be even quicker than that.
Awesome. Yeah, I definitely agree. It's a lot of information from a lot of shadowing I've done. Next question from Nikki in the audience. They ask, what do you recommend high school students do to get prepared for this career, for your career, a physician, or for medical school in general?
I think the most important thing you can do, one, is to keep an open mind. I think one thing that I wish I had known when I was in your position applying to colleges is I didn't know there's all these other roles in healthcare besides being a doctor. So one thing that I wish I could have done differently is to reach out to friends, family friends, and anyone else I know who work in healthcare and really try to find out about what they do. I would say that in college itself, you will find plenty of opportunities to explore this even further. So I would not worry about this too much before college, to be honest with you. College itself, you have, at least several years, one to decide on your major first, and after that, what you want to do after graduation. I think with universities too, you will have resources that you may not have had in high school. So some big universities are already attached to graduate programs, for example. So there will be organizations where you can join there at that time. So you have those built-in networks. It might not be as hard, as difficult to find, to hunt down opportunities. In high school, I just did a lot of general volunteering when I trying to think back to it. I don't think I did too much in terms of the medical field itself. I guess I was still undecided at that time, but I have a general interest in science, so to say. So whenever there was an experience with, oh, you can volunteer, as in a GDRF walk or something like that, that's what I did. But the bulk of my volunteering experience in healthcare actually came during my college years. I hope that answers the question.
Awesome, thank you. Let's ask a question live. Harneet, I see that your hand is up. I just lowered your hand. Go ahead and unmute and share your question. Would you like to unmute? All right, if you want to try again, go ahead and raise your hand one more time. We're going to transition to another live audience member. Madison, your hand is also up. Go ahead and share your question.
Yeah, thank you so much, first of all, for the presentation. I really enjoyed it. And you mentioned when you were around our age, you were pretty undecided. So I was wondering if there were any mentors or experiences that really brought you towards internal medicine.
Of course, thank you for your question, Madison. I was actually the first one in my family to go into healthcare, period. No one in my family were nurses, pharmacists, or anything like that. I have been very lucky to have had mentors who have guided me along the way. They have no doubt played a huge influence in me becoming a physician. In terms of on how I find those, one, I got lucky. There was a family friend who I was really close with, and having that relationship as the foundation helped. And I used that as a jumping board to let that person introduce me to his colleagues, basically, and I branched out that way. I actually I looked up all the closest hospitals near my house, and I basically asked if they were accepting volunteers. So there was a local smaller hospital by me that had a summer program, and I had just and I applied to be a volunteer. I think I was at the front desk or at the gift shop for the whole summer, but that was the first steps that I took into the window of healthcare, so to say. Other opportunities in college, I did some shadowing, of course, mainly in the emergency department. I tried to shadow as many doctors as I could in different specialties just so I get a feel of it. Sometimes it's so hard to know what the job is actually like from listening to other people talk like me until you're actually, going through the whole day with them. So I really recommend to do that. Just reach out. Don't be shy. If you know anybody, friend of a friend, reach out to them. I mean, as a physician myself, I am really excited to show people who are interested in healthcare, and it's really a way for us to pay it forward because we've had so much help along the way to get to where we are today.
Thank you so much. Another question from the chat, also from Nikki. Do you still have to go to medical school if you would like to be a scientist researching medicine?
That's a good question. The short answer is no, you don't have to. There's PhD programs out there that's geared towards research. That being said, there are doctors who go through medical school and their focus is actually on research, not so much patient care. Those are the two terms that you'll hear a lot, either clinical care, which is treating patients, or research, so kind of working in the lab, on a wet lab, on some bench work, basically. The short answer is no, you don't have to go to medical school. There's PhD programs out there, and I bet there are other master's programs that you can do too.
Awesome. Next question from Samvi in the chat. Do you recommend foreign exchange in medical school, if you have any experience with that?
Oh, I do not have, you mean exchanging as students to foreign medical schools?
I believe so. I know we have exchanging medical school programs in the United States, but I don't personally know of any like foreign exchange programs. Do you know of any?
I do not. So the medical school, I went to University of Arizona in Phoenix. We did not have foreign exchange students. That being said, we did have opportunities to rotate in different hospitals or even different states. When you are in your last years of medical school, so medical school is 4 years, right? The first and second year is basically classroom learning. You're in the books learning through classes. Third and fourth year is you have more clinical experience. That's when you get to rotate through different specialties in the hospital, in the clinic, in the community. In your last year of medical school, you can rotate at other hospitals. So you can rotate in a different state, for example. And I'm sure there are probably opportunities out there that allows you to rotate out of the country too. It just depends on what your program already has in its place.
Perfect. Thank you so much. Another question from the chat. Rachel asks, when do medical school students typically choose what specialty they want to pursue?
Yeah, so I think it's different for everybody. Some students already know, like they know, I want to be a neurosurgeon from the get-go, and that's great. For me, I had no idea. I mean, it took me a long time to decide to be a doctor in the first place. So my goal for the first half of med school is to get through it. And then as you go through your learning, you kind of realize what you enjoy, what things you enjoy more learning about than others. So if you enjoy learning about anatomy more, maybe surgery is your thing. If you enjoy about microbiology more, maybe infectious disease will be your chosen specialty. I decided during my third year of medical school, that's when we start rotating in the hospital and you actually get to see firsthand, living it day in, day out, a month at a time, a different specialty. That's where I feel like that's really when everybody gets an idea, their vision becomes clearer in terms of what they want to pursue at that time. You have to decide, you have to decide by, I would say the end of your third year will be the latest because you have to get letter of recommendations, all of that in place in anticipation for the application during your last year of med school.
Okay, awesome. Thank you. Kirtana from the chat asks, this is a more personal question that can also apply to some other families. What do you recommend for someone who grew up in a family of software engineers and no healthcare professionals? I was not able to get much support from my family in terms of opportunities for internships and shadowing.
Yeah, that's a really good question. I relate with you, Kirtana. I mean, none of my family was in healthcare, right? So I felt like I didn't really know who to ask my questions to. If you know anyone and if you have a friends of friends who work in some form in healthcare, I would recommend reaching out to that person. When I was in college, I took full advantage of all the pre-health organizations I could find. I found that they have already had the connections with the grad school, the medical school, and I just kind of used the opportunities that are already available there. It is so hard to just email a doctor out of the blue and just be like, hi, I'm a random student. I'd like to follow you at work for a day. That's hard because they're busy as well. So, but however, the doctors who are interested in having students around, they are typically already, involved in organizations like this, pre-health organizations. So I recommend going to those meetings and just see what kind of opportunities they have. And honestly, you also meet people who have the same interests as you. I actually met one of my best friends throughout one of the introductory meetings there, and it's so helpful to have someone going through the process of application with you, for example, because the MCAT, at least at that time, I'm not sure with the standardized testing how it's going to shape in the future, but at that time there was a very emphasis on MCATs, for example. And it was really nice to be able to have someone through the process with me together so we can share resources. So I recommend really taking advantage of programs that are available through your institution.
Awesome. Thank you so much. We have another question from the chat. Do you recommend any volunteering opportunities, or when and where you should volunteer in high school or an undergraduate?
Yeah, good question. So I think in order to show that you have an interest in healthcare, you have to prove through your volunteer experience, right, that you know what you're getting yourself into. I believe that this is the point of volunteering. It's also about giving back, but it's showing to the admissions committee that yes, I have fully thought this decision through and this is the career that I want to pursue. So it is a commitment. As you see, it's a long journey. So having some form of volunteering in healthcare, so shadowing summer programs at local hospitals, there's even conferences too. I would look at those. What I also want to add that I think a lot of people not talk about is volunteer in something that you really care about. So for me, I was born in Indonesia and I moved to the States when I was 13. And I remember it was really difficult to transition, culturally and with the language and everything. So I wanted, there was this calling in me that I wanted really to give back to these types of communities. So when I was in college, I wanted to really work with the immigrant population, specifically from Africa, from Nigeria. So I volunteered to teach a few English as second language or ESL courses. And then ultimately I had, more expanded roles as I go through. I thought that I really believe that you need to do something that speaks to you, because medicine is not just medicine itself. It's about service, right? It's about doing what you can to help other people. And also keep in mind doing things as a commitment. So if you really enjoy doing something, commit to it for a year or 2 years, however long it takes, because that's also something that the admissions committee, I think, would like to see.
Thank you so much. Just to quickly add on to that question, what do you know or do you recommend volunteering in hospitals during the pandemic?
Oh yeah, to be honest with you, I don't know if there's a lot of opportunities right now in the hospital, because even at my hospital, it's we just allowed a 1 visitor policy a day for our patients. So I can't imagine that the volunteers are back. Actually, have not seen them yet. So I think you're right. I think this is going to be difficult at this time. I wonder if there are other ways to do this, outside. I wonder if there are ways to volunteer even during the COVID vaccination, statewide vaccinations. So you don't have to have a medical background to do this. It can help doing simple tasks, asking patients preliminary questions, and all of that. So I think there's other opportunities, but you're absolutely right. In order to be back in the hospital, it's gonna look different moving forward.
Okay, thank you so much. Joy asks, she's a Canadian student graduating high school next year and is interested in practicing medicine in the States. For people who come from outside the United States, would they be able to apply in an undergraduate program in the States? And if not, what would be a more practical pathway? And would they be eligible for scholarships in the States? So this is kind of a specific question, but whatever experience you have, that would be great.
Mm-hmm. Sure. I mean, just to give you a perspective, we at Mayo Clinic, we do take foreign graduate medicine. So foreign graduate students who did their medical school outside of the US into training with us in Mayo Clinic in Arizona. So match day just happened Friday. So a lot of medical students just matched into residency. And we just found out that actually 2 or 3 of our first year residents next year are actually from Egypt. So it's definitely possible. If you look at the statistics, there are a ton of foreign graduate medical students who have matched into US residencies all the time. I'm not sure about the exact process, to be honest with you, on this. And I think the other hurdle may be you have to take the standardized tests that we have in medical school, the American version of it at least. So step 1, step 2 for the licensing exam. So that might be one. But for undergrad, you can definitely, it doesn't matter where you're from, you can always apply to a US undergrad too. I think it just depends to make sure you fulfill the qualifications and the requirements for first year college students.
I also, as an undergrad, and having friends who are international students, highly recommend just emailing the admissions committees at the universities. They are more than happy to answer any of your questions.
Great idea.
Lily from the chat asks, she was wondering what major you would recommend if they wanted to go into healthcare.
What major? I think any pre-health major would help. I did biology, so I learned about plants and ecology during college. I wanted to pick the broadest science major I could find in undergrad because I wasn't sure if I wanted to be a physician 100% at that time, but I knew I liked science. So I picked biology and I took courses in physiology as well. That being said, I have colleagues who have had other majors, philosophy, econ, poli-sci, who are now doctors. You do have to have the basic science courses though, and I think they're listed online for every medical school, but you have to have biology, chemistry, physics, and all of that. So you can have a different major as long as you have these qualifications. These completed coursework, you should be able to apply to medical school.
Awesome, thank you so much. What opportunities generally can you recommend to high school students before applying to university?
Can you repeat that question, Lexi? Sorry.
Of course. What opportunities would you recommend to a high school student before they apply to university?
In terms of
I guess if they're interested in healthcare.
Yeah. So aside from shadowing and volunteering, I think those are the 2 biggest ones. And let's see, let me think back to what else did I do in high school. I think one time I did like a summer camp in a pre-health conference. That was really helpful. Oh, I forgot to mention, I had traveled abroad on an international mission trip to Peru with a healthcare organization, actually. I can't believe I forgot to talk about that. I did that during my last year of college. University of Arizona had this partnership with an international organization for pre-med students who are interested in traveling to South America. And at that time, I really wanted to hone my Spanish speaking skills. So I thought this was the perfect opportunity for me to go. And I thought the cost was reasonable at that time and I could afford it, thankfully. So I went for a month to Huancayo, which is a smaller village outside of Lima. And I spent a month, no, actually 5 to 6 weeks there, rotating through different clinics, giving out vaccines, doing home visits. It was an amazing experience. And I recommend anyone to take advantage of that if they can. You don't have to go, so far internationally. There's always rural options too. If that's something that you're interested, I'm sure there are clinics out there who are excited to have students rotate with them for the summer or anything like that.
Awesome. Thank you. How do you avoid burnout, and how did you avoid burnout in undergraduate and medical school?
Yeah, I'm really glad you asked that because burnout is a very real thing and we should talk about it more often. I think when I think back in college, for example, so just full disclosure, I did not do well during my first 2 years of college, and I never thought I could have made it to med school. I thought that I didn't really have the grades to make it, and then I had different priorities at that time. And I thought that was a very stressful time for me. By the time that I had realized that I really wanted to be a doctor, I said, oh my gosh, the door has closed. There's no way for me to turn this around. So that was a really difficult moment for me. I kind of turned it around by really relying on my community. I know that sounds really cheesy, but I found a job that really motivated me. So I became a resident assistant. So I was living in the dorms, and that really pushed me to become a role model, because I wanted to set a good example for the freshmen, basically. So that on its own really pushed me to be the best just person I could be. And that was the turning point for me. So I would say find a group of people who you idealize, who you want to be like, and incorporate those values to your own. And from that, I was able to be a competitive applicant for medical school. Now, during medical school, that is very stressful on its own, just because of the expectations, the amount of information you have to know, grades, and all of that. Again, it's all about my class, my classmates particularly. I had a very supportive class. So I went to a med school where it's pass fail. So there's a lot of incentive to work together, because everybody wants to pass. So everybody was sharing notes, lesson plans, studying with each other. And it was a very supportive community. And while your family can be there to support you the entire way, it's these people really alongside you who know what you're going through day in, day out. So I would highly encourage you to kind of open up a little bit, and lean on your colleagues if you have to.
Thank you so much. We're going to ask 2 more questions as we have about a couple minutes left. And I think the next question I would like to ask is, let's see, I'm like trying to pick a good one for our last question. They're all good.
Pressure.
No pressure. Oh, yeah, let's do this one. Would you recommend going to a prestigious undergraduate school to get into medical school?
Oh, this is a really good question.
Yeah.
Okay, full disclosure, I went to a state school for med school, and I was perfectly happy going through a state medical school because, one, it's a lot cheaper as well than going to a private school. That being said, it depends when your goal is. I am a full believer that no matter what program you're in, you are going to get where you want to be. Look at all these doctors who have graduated. Not all of them are from Harvard or from Ivy Leagues. So yes, you can be just as successful in your career no matter what school you go to. Now, would it be easier to get into med school if you graduate from a well-known undergrad? Probably yes, right? Because if you look at the top 20, 50 medical schools and look at where they recruit from, it's very typical, right? They recruit from the top 50 universities in the United States. And occasionally they would also recruit students from state universities and community colleges and stuff like that. So would it be easier for you? Perhaps, but it also depends on if you thrive in that environment. So during my first year, I actually went to a different school who was actually more prestigious than University of Arizona, but it was not the right environment for me. I did not thrive in their culture as a university at all. And I found much greater success at U of A, at University of Arizona. So I thought that change was perfect for me. And it's all about what you do with your time and how you take advantage of the resources that are available to you. So if you go to a prestigious school, but you don't do very much else besides just studying, you don't volunteer, you don't do research, then what's going to make you stand out more than someone who goes to a regular school and becomes a much more well-rounded applicant? So I would say, go to a school where you can find the most supportive environment. If it means going to a school where you can be close to your family and friends, then by all means do that, because for your mental health, it's going to be a lot easier for you to succeed and excel in that kind of environment. I hope that answers the question. I know it was kind of long.
No, I think that was a perfect answer. As someone who also who currently goes to a state school, applying for medical school, it has also been difficult thinking, you know, I should have gone to a more prestigious school, but really, this is your life. Like, it just depends on where your route is. And I totally agree with everything you said. Let's ask one last question. What did you do to help meet the qualifications in undergraduate if your grades were not up to the level of medical school applications?
Yes, I can definitely answer this, and I will answer very honestly. I was very well aware that looking at my GPA, it was underneath of what the average admission GPA would be for typical med school. So I knew I need to excel and I need to kind of round out my application even more. So that's why I spent so much time making sure that I have volunteering. I spent a lot of time shadowing to make sure that clinical experience is there, and also doing other things that's not related to medicine, because I'm a real person. So all these things are really important. I really wanted them to see me as someone who had other passions besides medicine, because that's how you cope with the difficulties of being a doctor sometimes. And also, full disclosure, I took the MCAT twice. The first one I did not do so well, and that's another reason why I took a gap year between high school and college, because I had to retake the MCAT. And I think one of the things when I had attended medical school and I was speaking to the admissions committee, they had told me that, one of the things that we look for in an applicant is, you know, their resilience, right? Are you dedicated? This is what you want, you know, went back and tried again. You understood your mistakes, and this is what you did to correct them. And I was very forward with everything that I had done, you know, in college, and how I rectified my mistakes. And I mean, we're only human, and they're very receptive to that. So it's all about growth. So as long as you demonstrate how you improve from your grades, for example, by having a more well-rounded application, I think you would do just fine.
Thank you so much, Dr. Feller, and thank you. That is the end of our Q&A session. Thank you so much for joining us today. I personally learned a lot as well as a pre-med, and I'm sure the rest of our audience members as well who are interested in pursuing careers in healthcare when they make it to the pre-med area that we are all in, and eventually medical school and beyond, and other schools as well. And so thank you so much for joining us. Dr. Feller, feel free to stay for the rest of the event if you want. If not, no worries. There's a few more questions in the chat that we didn't get to. Feel free to scroll through those and direct message some other audience members if you would like to answer those. If not, no worries as well. So thank you so much for joining us.
Thank you.